and Dr. Mihai Adrian Dobra. He will be providing us a comparative look at the US and Romanian public health approaches. He's an assistant professor of urology at Davila University of Medicine and Pharmacy in Bucharest. He specializes in urology and urological oncological surgery. So I hope the first presenter today was also of interest. His focus is in kidney tumors and bladder tumors and endourology. But I brought him today to give us the reverse perspective from a presentation that we had several years ago from one of our IRF Council board members, Surgeon Gabriel Tender from the LSU Health.
Online here.
Oh, he's online as well.
Thank you for the invitation, Theo. Thank you.
Yes, of course. So that presentation compared the two public health systems a while back, but it was the presentation of a Romanian American going to Romania and helping the brain surgery and spinal surgery there. And he spoke, and I'll put that presentation to the side here for in our chat box for participants. And now I wanted, after this time, to have the other perspective of a Romanian surgeon visiting the United States and comparing the two systems. So we'd like to welcome now your presentation. Thank you for joining us from Bucharest.
Thank you. First of all, I want to start with a short video that I made with my wife in Virginia Hospital Center. The video is on YouTube, so if you have patience for a couple of minutes before my speech, you can take a look. Unfortunately, the video is in Romanian language, so I will share you immediately.
We may not have the sound. We do not hear anything.
Virginia Hospital Center.
That's good. Now we can hear. Thank you.
Fost locul în care doctorul Mihai Dobra a avut ocazia să lucreze cot la cot cu medici de top din domeniu și să deprindă noi aptitudini cu care la finalul stagiului se va întoarce în țară. Înainte însă a împărtășit totul cu noi.
A fost o experiență extrem de bogată și plină de informații. Practic a fost o lărgire a orizontului medical. După două experiențe europene, una în Anglia și una în Germania, o mare dorință a fost să vizitez o clinică de top în Statele Unite ale Americii, în care să preiau cât se poate informații medicale și eventual să le transpun de asemenea pe cât se poate în sistemul național românesc de sănătate. Toate lucrurile astea țin să aducă un update intelectual. Recomand din tot sufletul nu numai experiența americană, ci cât se poate de mult medicii ar trebui să vadă și alte sisteme și dacă se poate să se adapteze și să preia lucrurile bune. Că, fără discuție și aici sunt lucruri interpretabile.
Cum peste 90% din intervențiile chirurgicale de peste ocean se desfășoară robotic, Mihai Dobra este pregătit la întoarcerea în țară să împărtășească medicilor români noi căi de dezvoltare în domeniul pe care îl cunoaște cel mai bine, urologia.
Dacă vorbim de chirurgia minim-invazivă, dacă vorbim de chirurgia robotică, ea nu mai este o chirurgie a viitorului. Ea este o chirurgie, în primul rând, a prezentului. Lucrurile ar trebui să se desfășoare și în România într-o emergență mai activă și să beneficiem în sistemul sanitar național de asigurări de sănătate obligatorii și de roboți.
Însă, momentan, în România, scenariul este diferit.
Medicina înseamnă, din păcate, finanțare. Și când spun din păcate, spun că în România, în acest moment, vorbim de subfinanțare, comparativ cu ce se întâmplă în Statele Unite ale Americii. Disponibilitatea tehnicii aici este extrem de largă, beneficiile pacientului deseori fiind majore, comparativ cu sistemul național.
Cât despre ritmul în care apar tratamente și tehnologii noi în această specialitate, dar și despre modul în care sunt implementate metodele inovatoare, medicul Mihai Dobra spune că a simțit pe pielea lui că Statele Unite sunt cu un pas în fața tuturor.
Lucrurile aici se întâmplă dedicat. Research-ul, cercetarea e un domeniu primordial în care se fac foarte, foarte mulți bani. Lucrurile nu se mai întâmplă pe cohorte, pe loturi mici. Vorbim de cercetare aici de genomică moleculară, de secvențiere a ADN-ului, de tratamente target terapii dedicate în oncologie. Toate lucrurile astea înseamnă bani, înseamnă echipe majore, înseamnă o administrație complexă.
Iar viitorul sună și el promițător.
Este o explozie de informație, este o explozie de tehnică, de inovație medicamentoasă, de tratamente. Influența companiilor farma și de tehnică medicală inovativă aici este extrem de ridicată. Lucrurile sunt atât de segregate financiar încât inclusiv tehnicile, tratamentele, finalitățile sunt diferite în funcție de finanțării.
Experiența de operă din Statele Unite ale Americii a fost și un prilej de a lucra cu unul dintre cei mai prestigioși medici din străinătate. Considerat unul dintre pionieri în urologie, doctorul Robert Norkin este primul medic urolog din Washington DC care a efectuat o prostatectomie laparoscopică, iar întreaga experiență i-a rămas și acum întipărită în minte.
That first operation was very, very difficult. I think back to those days, and I remember that first day taking an operation which I had been doing for years as a traditional open surgery, that I could do that operation in maybe an hour and a half or 2 hours. And that first day, that first laparoscopic case took almost 9 hours. On the other hand, that same patient who had a 9-hour surgery went home the next morning.
De la prima intervenție de acest gen au trecut ani buni, dar reușita de atunci are și acum eco.
For the patient, this was really revolutionary in the sense that because the incisions were smaller, there was much less discomfort. This translated into a much quicker recovery, shorter hospitalization times. I've always enjoyed the challenge of trying to push the envelope a little bit. If we don't think about innovative ways in whatever profession we're in, we're never going to make progress.
Doctorul a vorbit și despre trainingul din această vară din poziția de profesor.
I've enjoyed very much training those people, seeing them grow. But they have also challenged me because they are young, because they are very in tune with technology.
Pentru sistemul medical din România are și un sfat, să nu se oprească din dezvoltare.
The operations that have been done in the more traditional open way for many, many, many years are still very good operations. So no one should walk away from this conversation thinking that if they don't have access to a Da Vinci or they don't have access to a laparoscopy, that the surgery they're going to get is somehow inferior. Just the idea that they're continuing to be aware of these methodologies that are out there will allow them to not only take some of those skills back to what they're doing in their home area or their home countries, but also when the time, hopefully the resources become available for them to have that technology, they're already familiar with it and they can jump on board very, very quickly.
Thank you for your patience. I will start my presentation. I stand before you today to discuss a topic of utmost importance: bridging healthcare, comparative analysis, and collaborative operations in US and Romanian public health system. As a primary care physician in urology with extensive experience in urologic oncologic surgery in Bucharest, Romania, and the recent encounter with the innovation healthcare system in the United States, I'm excited to share insights and potential pathways for collaboration between those two distinct systems. My experience in American soil came with valuable information, new methods of development in the field, and a vision defined by innovation. It was there that I also met one of the pioneers of urology, Dr. Robert Norkin, considered one of the pioneers in urology. Dr. Norkin is the first urologist in Washington, D.C. to have performed a laparoscopic prostatectomy. My journey to the United States was driven by a desire to bring back cutting-edge technologies and knowledge to adapt and enhance the Romanian healthcare system. It is our duty as medical professionals to engage in continuous medical education and remain open to the advancements and the practices adapted to Western hospitals. The exchange of information, even simple means like congresses or international medical association, can lead to remarkable improvements in our healthcare practices. Traditionally, surgery has been associated with the image of scalpel as an indispensable tool. However, the world of medicine is in constant state of evolution, driven by technological advancements. While classic surgery continues to excel, new technologies have revolutionized the field, making procedures more efficient and patient-friendly. During my time in the United States, I witnessed groundbreaking innovations like aquablation, a technology that utilizes water jets and artificial intelligence for precise urologic procedures, drastically reducing operation time and post-operative complications. Innovation and technology are often more readily adopted in North America and Canada compared to Western Europe, where progress may be slower. However, it is essential to remember that commercial medicine does not necessarily equate to superior outcomes. The choice of surgical techniques depends on various factors, including the hospital's capabilities, the surgeon's experience, and modifiable patient-related factors. Access to the modern technology often comes with a hefty price tag, highlighting the importance of health insurance systems that provide broader access to those innovations. Speaking of health systems, both the US and Romania have unique approaches to healthcare fundings. Romania operates in a socialized system designed to assist all citizens, while the US relies heavily on a predominantly private system with limited charitable support. Both systems have their strengths and weaknesses, but they underscore the importance of findings, a balance between humanitarian principles and sustainable findings models to ensure quality medical care. My experience in the US also led me to explore the concept of pay-for-performance systems. The system raises questions about the selection of performance measures, the expected outcomes, and the financial implication for healthcare providers. Payment initiative can drive innovation, but they can also hinder the adoption of cost-saving approaches. It is a complex issue that requires careful consideration. As we compare the Romanian and American healthcare system, it becomes clear that neither is perfect. My heart leans towards social medicine, which emphasizes accessibilities for all, akin to system in the United Kingdom and other parts of Europe. However, there is a room for improvement in both systems to enhance the quality of the care and streamline funding mechanism. Looking forward, I see great potential for collaborative efforts between Romania and the United States. In particular, I would like to highlight the Fundeni Clinical Institute, ICF, in Romania. ICF is a leading healthcare institution where over 1,000 continuous hospitalization and over 1.8 million medical analyses are conducted annually. The institute specializes in various medical fields, including transplantation, gastroenterology, urology, and personalized medicine. Its involvement in the international research consortia and cutting-edge genomic platform make it a valuable partner for collaborative research projects. ICF is also actively engaged in national impact screening programs addressing issues such as colorectal cancer, prostate cancer, and hepatitis B and C. Their commitment to the research and preventive care aligns with the principles of innovation and excellence we have seen in the United States. In conclusion, the comparative analysis of the US and Romanian public health system reveals both challenges and opportunities for improvement. It is our responsibility as healthcare professionals to learn from each other, adapt to evolving technologies, and work towards delivering the best possible care to our patients. Collaborative ventures such as those with Fundeni Clinical Institute hold the promise of advancing medical science and ultimate benefit the health and well-being of our communities. Thank you for your attention.
Thank you, Dr. Dobra, and congratulations on your visit and the learning process that it involved. I set to the side a link to a presentation of Surgeon Gabriel Tender, precisely to show that it is not just technology. Sometimes surgeons going to Bucharest learn techniques that are developed there because of the need and the low resources there, and they end up patenting some of those procedures and coming up with new products here in the United States. So it's a both way learning process on both sides. Yesterday we concentrated on precisely on promoting this kind of human contact and exchange programs where professionals such as yourself may come to the United States and see the way things are done here and learn from the process. It is not necessarily something that gets started by invitations from here, but something that needs to happen. And this is why we hope that the visa waiver program will help us increase that mobility and improve our ability to learn from each other, learn from the two settings. Thank you so much for your presentation. I know it's very late in Bucharest, and